Hi everyone, welcome back to my channel. Today I'm diving into a topic that affects millions of people, but it isn't discussed enough, and that is testosterone deficiency. As someone who's navigated hormonal health challenges since being diagnosed with PCOS and hypothyroidism at 15, I understand firsthand how critical hormone balance is for overall well-being. Now, whether you're a man or a woman, testosterone actually plays a vital role in your health, and yes, even women need proper testosterone levels to function optimally. I discovered this during my own health journey, and today I want to share what I've learned about some reasons why testosterone levels are plummeting across generations and what we can do about it. So what is testosterone and why is it so important? Well, it's a crucial hormone for both men and women, although men naturally produce about 10 to 20 times more of it. In men, testosterone is responsible for muscle mass and strength, bone density, fat distribution, red blood cell production, sex drive and fertility, and energy levels and mood regulation. In women, testosterone contributes to bone strength, muscle maintenance, energy levels, cognitive function, sex drive, and an overall sense of well-being. Now, when testosterone levels fall too low in either gender, it can lead to significant health issues and also just decreased quality of life. Research shows that testosterone levels have been declining steadily across generations. Now, men today have significantly lower testosterone levels than men of the same age just a few decades ago. This isn't just an issue for older adults. This article points to a concerning case study from the National Center for Biotechnology Information that I want to share directly. A 20-year-old male Division I collegiate swimmer had very low testosterone levels, but his other hormone levels were completely normal. Tests showed he didn't have thyroid or pituitary problems. He was diagnosed with RED-S, which is relative energy deficiency in sport. And with help from the sports medicine team, he ate more, trained less, and after gaining a bit of weight and reducing exercise, his testosterone levels actually returned to normal. This case highlights something very important, which is sometimes low testosterone is not due to aging or disease, but lifestyle factors that can be modified. Let's look at some of the main reasons why testosterone levels are dropping for both men and women. First, we have poor sleep quality or inefficient sleep, chronic stress and elevated cortisol levels, sedentary behavior and lack of physical activity, obesity and excess body fat, which converts testosterone to estrogen, poor nutrition and vitamin deficiencies. And then we have environmental factors, including exposure to endocrine disrupting chemicals and plastics, pesticides, and personal care products, increased exposure to phytoestrogens in certain foods, air and water pollution. Low testosterone levels can also be due to certain medical conditions, such as hypogonadism, primary or secondary, pituitary disorders, metabolic disorders like diabetes, thyroid dysfunction, and in women specifically PCOS, which can cause elevated testosterone, or adrenal insufficiency, which can cause low testosterone. And the latter was my case. I had virtually none. And then relative energy deficiency in sport, RED-S, as mentioned in our case study. And there are also certain medications and treatments that can cause low testosterone. So certain pain medications, some antidepressants, chemotherapy, radiation treatment, and then statins and other cholesterol-lowering drugs. So here are some signs and symptoms of low testosterone. Based on what I've observed and what I've researched, this is not direct medical advice. So how would you even know if you have low testosterone? Well, I'm gonna break it down for men and for women. For men specifically, decreased sex drive, reduced muscle mass, increased body fat, fatigue and low energy, mood changes, irritability or depression, brain fog and concentration problems, loss of body hair, and decreased bone density. For women, some symptoms might be fatigue and low energy, decreased sex drive, reduced bone density, loss of muscle tone, mood changes and depression, difficulty concentrating, weight gain, and sleep disturbances. Remember, many of these symptoms can overlap with other conditions, so proper testing is essential before just assuming testosterone is the issue. So let's get into some natural ways to boost testosterone before we even discuss any possible medical treatments. Number one is optimize your diet, so eat sufficient protein, 0.8 to 1 gram per pound of body weight. Include healthy fats from olive oil, avocados, nuts, fatty fish. Consume zinc-rich foods like oysters, beef, and pumpkin seeds. Include vitamin D-rich foods or get adequate sun exposure. Minimize processed foods and added sugars. Maintain adequate caloric intake, because if you're too low in that, your hormone levels can crash. Next, you're going to want to exercise strategically, so incorporating resistance training into your routine 2 to 3 times per week. You can include high-intensity interval training, and endurance exercise if it's about an hour at a time, because you don't want to increase or spike your cortisol levels, because that can actually lead to low testosterone as well. Then there are certain lifestyle modifications you can make. So prioritize your sleep. 7 to 9 hours of quality sleep is the best. Manage stress through meditation or yoga, mindfulness. Minimize alcohol consumption, maintain a healthy weight, reducing exposure to endocrine disrupting chemicals. So you can use glass or stainless steel water bottles instead of plastic ones, especially if your water bottle will be left out in the sun during a sports game or a long run. My doctor actually has a lot of patients who are 15, 16, 17-year-old boys who have incredibly low testosterone because of the plastics and endocrine disruptors that have leached into their waters or Gatorades during long sports games. However, if you need or prefer plastic water bottles, then you can always use the ionized alkaline water from Essentia. Just beware that most plastic water bottles are left in the sun for very long periods of time when being shipped to the store where you buy them from. But certain companies like Essentia actually make sure that their water bottles are brought into the store as quickly as possible to prevent any endocrine disruption for you. Next, you can supplement wisely. So vitamin D, you can take that if you're deficient. You can take zinc if you're deficient. You can take magnesium. Ashwagandha has actually shown promise in some studies. DHEA for women under medical supervision. And then just remember that these natural approaches work best when implemented consistently over time. And also remember that results will vary from person to person. Next, we're going to talk about medical treatments for low testosterone. According to the Cleveland Clinic, these include, for men specifically, testosterone replacement therapy, although women can get this too. You can get that through topical gels, injections, patches, pellets, oral medications, or creams. And for women, low-dose testosterone creams or gels, often compounded, DHEA supplements, which the body can convert to testosterone, and addressing underlying conditions like adrenal insufficiency. On an important note, testosterone therapy should only be used when there is a documented deficiency, confirming through blood testing. Proper diagnosis is crucial before starting any hormone therapy. Because I had the hormone diagnosis and I got the right help, I can tell you it has been amazing to have a functional amount of testosterone in my body. I've had improved mood, I've had improved energy, and I've actually been able to build muscle in the gym again. Now, of course, there are going to be some risks, so let's get into them. First, for men, we have acne or oily skin, sleep apnea, breast enlargement, testicular shrinkage, reduced sperm production, increased risk of blood clots, potential effects on the heart health, which is controversial, but do your own research on that. For women, acne, oily skin, facial hair growth, voice deepening, hair loss, mood changes, and this is why proper medical supervision is essential. Testosterone therapy is not a lifestyle enhancement, but a medical treatment for a specific condition. Whether you're a man or a woman, maintaining optimal testosterone levels is crucial for health, energy, and your quality of life. And the good news is that many causes of low testosterone can be addressed through lifestyle modifications. And if you suspect that your low testosterone might be affecting you, I encourage you to, again, track your symptoms, request appropriate blood tests from your healthcare provider. As someone who has been through this before, that step is very important. Also do your own research if you're worried about any of the risks or any of the benefits as well. Start with natural approaches first to optimize your hormones, and then consider medical treatment only under proper supervision and after confirming a deficiency. Have any of you guys experienced symptoms of low testosterone? Let me know in the comments below, and do not forget to subscribe for more content on hormone health and wellness. Thanks for watching. Your body and your hormones will thank you.